Hello, guys. It's a pleasure to be here to talk for the All India Ophthalmology Society. I'm not live because it's Friday morning here in Brazil. I am in my day surgery in the operating room now, and I will try to go online for the discussion. Thank you, Dr. Ashvin, bro, to invitation. Here my disclosure about this talk. And I'd like to start with this question. Some Sergio asked me, Sergio, there are a lot of rings in the market. Why you try to create a new ring? When I start like a preceptor, like a staff in the public hospital in my city in Brazil, the price of the all cataract surgery for the surgeon, for the anesthetic, for the IOL, for everything is $100. Yes, is you are in a developing country. In our expansion rings in Brazil, the price is about 120. Then the expansion rings in Brazil is most expensive than the price of the all cataract. Then I was talking how I can solve it. And in 2015, 2014, I was in the sofa watching a TV show and have this video that starting research with 3D printer, with using neurological surgery and orthopedics. Then I have the idea, oh my God, I can do a intraocular device, expansion ring, with a 3D printer. Observe my five first designs, and I like to say, don't. It's difficult to give in the to have the final design. Look, these rings, my first Canabrava rings. Okay, then I produce the first ring. You can see this video in the 3D printer. It's impossible to work it. It's about in 2014 and trying eye pig's eye. Here, the first model that works, it are in PubMed. It was the first ophthalmology device, intraocular device produced in the 3D printer that works. Sometimes don't know about it, but the Canabrava rings works this. And when the game changer in ASCIS Barcelona 2015, when I received this prize in the ASCIS Film Festival, and the AJL from Spain came to me, Sergio, I like your ring. You'd like to produce it in our company? Yes, of course, why not? But it was not my first goal. Then you start with this design two, and this final design that you can see. And here the final design of the ring, you can see the first ring in the market that there is no like a hook like this design. You are alternate parts. The small parts, they're not above this big part that go above the iris, and they're not under this part. And you have two hooks to stabilization. Because and you receive this prize and ASCIS with the best paper of the section. And it is important about the ring. And my suggestion with other rings too. Insert position, because if you see here, the large idents need to be above the iris. I like to say start with 3.5 to 4 millimeters, because it's not easy to start the technique of the Canabrava ring. And white to white bigger than 11 millimeter. The competitors, the market. As I told you, there are a lot of rings in the market, amazing rings. For example, Dr. Boris, I'm fan of Dr. Boris Maliugin. But what's the difference of the Canabrava ring? Is the more thin in the market, only 0.4 millimeter in vertical height. The another rings, Irene, Oasis, Morsche, Maliugin, there's about 0.7 to 0.9 millimeters. Because one of this point, I call my ring of the shelling ring is really it's not easy to start the technique. The surgeon needs to be experienced in. I don't suggest this for beginners, but when you demand the technique, you can do a lot of challenge case like this one. You can see a patient with, I like to do a blue bubble technique that I have described. You do a 1 millimeter incision, go with a cannula, and you go behind the iris. You inject the blue, the trypan blue behind the iris. Then after you insert, you can insert the ring. Observe, the ring works like, and you can connect, and all capsule will print with the trypan blue, and you observe how the ring solve this problem. Here, another surgery that you can see. There's no pupil here, and I like to do a small cut with a micro scissor, and you can see, and then the ring works, and I connect the small indentation behind the iris, and the large indentation will be above the iris. Here you can see how the ring can stable in a patient with scleral fixation. You can see I'm connecting the small indentation, and again the right side of the small indentation, and then finally I connect the rook stabilization behind the iris, and the ring stays so thin in the anterior chamber because it's about the middle of the size of the height size of the other rings in the eye, in the market. Here I'm doing a IAMAN technique. You can see, and the ring stays stable during all the surgery. Then the trailing haptic of the IAMAN technique, and here I'm removing the first haptic. Then I remove the other haptic, and you can see how the IOL stays stable. So after to insert the flange inside the eye, I remove the capsule, and then I remove the Canabrava ring, and then you can see this part is easy to do. Okay, and I suggest you observe this patient. Observe, no anterior chamber. Then, in this kind of patient, you can see I'm trying to insert the trypan blue behind the iris, like I told you, the blue bubble technique, as you can see. But I like to do a anterior vitrectomy to decrease the pressure. And after to decrease the pressure, how the ring is so thin, I insert the ring in the iris, and then you can see how it's. And my question: it's possible to use no visco during the phantom? Yes, I think without suture. Okay, I think only the Canabrava ring and the BX from my friend Suven. Suven, I didn't put your ring in the market because you don't have BX here in Brazil. Sorry, bro, but you don't have here in Brazil. Then here you can see a patient that you do a phantom. You insert in the 1.4 millimeter incision. Then I remove the visco. Here the ring inside the catalyst, and then you can see how the patient can go walking and back to the operating room. Here I'm finishing. I'm removing the capsule hex and inserting a CTR, because you can see there is a disinsertion in the inferior part, and then after the fake emulsification, I remove and insert the IOL. I remove the Canabrava ring, and he moves the ring from the eye. It's only 0.4 millimeter, and then here I'm doing the iridodialysis. Also, as you can do, is a double flange, a Canabrava technique here, like we described for other surgery. Yes, but I prefer to use a polypropylene 10-0. Here the final results. Okay, thank you for the invitation. Here my Instagram. I have surgeries every week for share. Thank you.